In a world increasingly dominated by convenience foods, processed snacks, and sugary treats, the importance of fostering healthy eating habits from an early age cannot be overstated. The journey to raising children who are not only physically nourished but also emotionally connected to wholesome foods begins during infancy. Recent insights into child development suggest that introducing solids at the right time, offering appropriate textures, and cultivating mindful eating practices can lay the foundation for a lifetime of balanced nutrition. This approach challenges conventional wisdom and calls for a deeper understanding of how babies interact with food, their natural instincts, and the role caregivers play in shaping their dietary preferences. One of the most debated topics in infant nutrition revolves around the question of when to introduce solid foods. While many parents rush to feed their babies pureed vegetables or mashed fruits as soon as they reach a certain age, experts argue that this practice often overlooks the baby's physical readiness. A baby's body provides clear signals that indicate whether it is prepared to handle solid foods. For instance, the eruption of teeth serves as a biological cue that the digestive system is maturing and capable of processing more complex textures. Similarly, the ability to sit upright without support and demonstrate self-feeding behaviors reflects both motor skill development and cognitive readiness. These milestones are not arbitrary but rather essential markers that ensure the baby is equipped to explore the world of solid foods safely and effectively. The timing of introducing solids also varies widely among infants, underscoring the need for individualized approaches rather than rigid guidelines. Some babies may show little interest in food until well beyond their first birthday, while others eagerly reach for anything within arm's length as soon as they develop the dexterity to grasp objects. This variability highlights the importance of observing each child's unique cues rather than adhering strictly to external timelines. By respecting these natural rhythms, caregivers can avoid unnecessary pressure and create a positive association with mealtime experiences. Furthermore, delaying the introduction of solids until the baby demonstrates readiness has been linked to better digestion, reduced risk of allergies, and improved nutrient absorption. When it comes to selecting the first foods for babies, simplicity and nutritional value should take precedence over elaborate preparations. Offering small pieces of fruit is one of the most effective ways to introduce infants to the concept of eating. Fruits like bananas, apples, or pears provide natural sweetness, making them appealing to tiny taste buds, while also delivering essential vitamins and minerals. Allowing babies to suck on these pieces not only satisfies their curiosity but also encourages oral exploration, which is critical for developing chewing skills. Importantly, starchy foods such as bread, rice, or pasta should be avoided until molars appear, as these teeth are specifically designed to grind tougher textures. Premature exposure to starchy foods can lead to digestive discomfort and hinder the proper development of jaw muscles. Another crucial aspect of early feeding involves steering clear of overly soft or pureed foods. Many caregivers mistakenly believe that blending vegetables into smooth consistencies makes them easier for babies to consume. However, this assumption overlooks the fact that babies are naturally wired to suck rather than swallow solid substances. When spoon-fed purees, infants often push the food back out using their tongues, a reflexive action rooted in their breastfeeding experience. Instead of persistently attempting to override this instinct, caregivers can embrace alternative methods that align with the baby's developmental stage. Providing whole, unprocessed foods allows babies to engage all their senses: touch, sight, smell, and taste, creating a richer and more meaningful connection with what they eat. The significance of teaching babies to chew cannot be emphasized enough. Chewing is not merely a mechanical process. It plays a pivotal role in shaping the structure of the mouth, jaw, and facial muscles. The masseter muscle, located near the jawline, is one of the strongest muscles in the human body. Its strength and functionality depend heavily on regular use, particularly during the formative years of infancy and toddlerhood. Unfortunately, modern diets dominated by soft, easily digestible foods have led to underdeveloped jaws and dental issues in later life. Dentists and orthodontists frequently report cases of misaligned teeth, narrow palates, and weak gum structures, all of which stem from insufficient exposure to crunchy or fibrous foods during childhood. To counteract these trends, caregivers are encouraged to incorporate more textured foods into their baby's diet. Vegetables like steamed broccoli, cauliflower, or carrot sticks offer just the right amount of resistance to stimulate chewing motions without posing significant choking hazards. It is important to note that gagging, a common occurrence when babies encounter unfamiliar textures, should not be mistaken for choking. Gagging is a protective reflex that helps prevent large pieces of food from entering the throat prematurely. Babies typically recover quickly from gagging episodes and continue exploring their food with renewed enthusiasm. On the other hand, choking occurs when an object becomes lodged in the airway, requiring immediate intervention. By distinguishing between these two phenomena, caregivers can feel more confident about offering appropriately challenging foods. Beyond the physical benefits of chewing, there is a profound psychological dimension to consider. Allowing babies to explore food with their hands fosters independence and enhances sensory awareness. When presented with colorful, varied options like vibrant florets of broccoli or golden slices of carrot, babies learn to appreciate the visual appeal of fresh produce. They also gain tactile feedback, gauging the temperature and texture of each item before deciding whether to taste it. This hands-on approach contrasts sharply with traditional spoon feeding, where the caregiver controls every aspect of the experience. Empowering babies to take charge of their own eating journey instills a sense of autonomy and curiosity that extends far beyond mealtimes. As babies transition into toddlerhood, maintaining healthy eating habits requires consistency and intentionality. One of the most effective strategies involves establishing structured meal and snack times. Constant snacking throughout the day can disrupt hunger cues and diminish appetite during designated meals. By limiting food intake to specific intervals, caregivers help toddlers develop a natural rhythm of hunger and satiety. This practice not only promotes better digestion but also prevents overconsumption of empty calories. Additionally, serving nutrient-dense foods like salads, steamed vegetables, or lean proteins before offering bread or other carb-heavy items ensures that toddlers fill up on wholesome choices first. Avoiding sugar and processed foods is another cornerstone of promoting lifelong health. Babies are born with an innate preference for sweet flavors, likely an evolutionary adaptation to favor energy-rich foods. However, excessive exposure to refined sugars early in life can condition the palate to crave unhealthy options and reject nutritious ones. To combat this tendency, caregivers should prioritize whole, minimally processed ingredients whenever possible. Fresh fruits, vegetables, legumes, and grains provide ample sweetness and flavor without the detrimental effects of added sugars. Over time, toddlers raised on such diets tend to exhibit broader palates and greater acceptance of diverse foods. Finally, creating a positive mealtime environment is key to nurturing healthy eating habits. Meals should be seen as opportunities for connection, exploration, and enjoyment rather than sources of stress or conflict. Caregivers can model mindful eating behaviors by savoring their own food and expressing gratitude for the nourishment it provides. Encouraging toddlers to participate in meal preparation, even in small ways like washing vegetables or arranging plates, can deepen their appreciation for the effort involved in bringing food to the table. Moreover, minimizing distractions such as screens or toys during meals allows everyone to focus fully on the shared experience of eating. In conclusion, the path to raising children with strong, sustainable eating habits begins long before they utter their first words or take their first steps. By honoring the natural progression of development, offering wholesome and appropriately textured foods, and fostering a supportive mealtime atmosphere, caregivers can set the stage for a lifetime of vitality and well-being. This holistic approach transcends mere nutrition. It encompasses emotional bonding, sensory discovery, and the cultivation of lifelong skills. As society continues to grapple with rising rates of obesity, diabetes, and other diet-related illnesses, reimagining how we feed our youngest members offers hope for a healthier future, one bite at a time. As we wrap up, remember that building healthy eating habits in babies is about more than just food. It's about creating a foundation for lifelong wellness. By paying attention to their natural cues, offering wholesome and textured foods, and fostering a positive mealtime environment, you're setting the stage for a healthier future. Every bite they take is a step towards stronger bodies, sharper minds, and a deeper connection to the joy of nourishing themselves. If you found these tips helpful, don't forget to give this video a thumbs up, share it with other parents or caregivers, and subscribe to the channel for more insights on healthy and wellness. Let's work together to nurture a generation that thrives on good food and mindful choices. Thanks for watching, and we'll see you in the next video.